Hey everybody, this is Dr. Sanders here again today with another tip of the week. Is there anyone out there who is suffering with pain in their shoulder, particularly pain when reaching overhead or behind the back, or maybe using some kind of sport with a racket, or we have to use the shoulder and it's kind of located in the back, that pain, and it happens over that time? Well, you may be experiencing pain coming from a muscle in the back that is being overwhelmed with its responsibility and not able to fully recover. This muscle is part of the rotator cuff muscle. It's called the Teres minor muscle, and it's located right here in the back part of that muscle. And its job as part of the rotator cuff is to keep the arm bone centered in the shoulder socket as we do motions, particularly motions of extremeness like reaching forward, back, and it helps to slow down and maintain that head doesn't move around and cause irritation in there. A lot of times when it gets irritated is because of either we're doing an activity over and over and over again, reaching, and it is not allowed to have enough relief during the day, be ready for the next day or at night. So that irritation during the day kind of builds and builds to a point where it literally cries out, "I've had enough, please don't do that anymore." Or the body will then either, I'm going to use different muscle groups to do that motion, which then puts those muscles in compromising position. So what we want to do, if we have to continue to do those work, maybe it's a job or sitting at a desk, we have our arms forward for a lot, or we want to take effort to give those muscles, this muscle, some attention. One of the great ways to do that is doing some targeted soft tissue release and massaging techniques. And I like to use a lacrosse ball to get in there and treat that muscle. Now, if you're going to use a lacrosse ball, it's kind of firm. You want to do it against a hard surface, such as wood, metal, thick glass, thick plastic, drywall. If you continue to use it against a drywall surface, it can actually create dents or even be pushed into the drywall. So first tip of the day with this exercise, don't use drywall. All right, so here we're going to use the door, like I said, to accomplish this. Once again, the teres minor muscle is, if you reach behind, you'll be able to find like where the shoulder blade kind of starts, it sticks out there. And what you want to do is you want to get the ball down there. Now it's kind of hard to get the ball back there. So what I like to do is I start on the edge of the shoulder and then I go down a couple inches there, start on the outside of the door, and you can lean into the door. That creates the amount of pressure you want on there. And I would just start with something neutral, and you're gonna roll across and you'll feel it right on that shoulder blade. Now, you'll know if you go too far because you'll feel another hard thing and then it kind of sinks in, and that means you're now on the paraspinal muscles. And you can work those too, but today we want to focus on those ones that are on the shoulder blade. So keep it to the shoulder blade. So it's short motions back and forth like that. If you want more intensity, you just bring the arm out and you work back and forth. And once again, make sure the ball is coming up to the shoulder, behind the shoulder, and not on the rib cage here. So you may be kind of a little slightly diagonal motion. And you're searching for tight, tender points in the muscle. Patients have often described to me, it feels good. It hurts, but it feels so good. If you find one of those points, just allow a little pause of the ball. There may be a slight increase in pressure on there, and wait about 15-20 seconds, and that intense feeling should reduce down if the trigger point is ready to reduce down. If it doesn't, then keep moving, rolling the ball in those areas. I would only spend about 30 seconds to a minute. If you have an active pain symptom in the back of the shoulder, like previously shown, then I would do about 3 times a day for a good several days, about a good week. If it doesn't reduce down after doing it for a week, it may be because we're not pushing enough or doing enough time, or it could mean that there is other things going on, other things such as a internal subconscious instability problem in the shoulder or in the neck or torso that is causing that body to overreact. Those muscles to overreact in that way, and you'll need to get professional help. And we here at Integrated Health Solutions, we are specifically trained to identify the specific moving patterns that are causing that compensation and instability. And what we specialize in is providing specific treatment plans that not only target the overreactive tissue, but also train and empower the patient on how to stabilize, use those body areas, the shoulder particularly, better when reaching up behind or working at a desk, so that that muscle doesn't feel like it needs to be overcompensating or overloaded throughout the day. So if you find you're not getting that relief, pick up that phone, give us a call, or jump online to www.ihsindy.com and you can schedule your appointment right there online with us, so you can get back doing those things you need to do or love to do without that pain and have that great experience again. Thanks again. Check out some other videos about tips of other areas that you can do to help with pain, and so you can get a better life. And thanks for watching.